It's a real pleasure to be here to speak with you today because I'd like to talk to you about some of the benefits that are available under traditional Medicare for people who have macular degeneration. In 2002, Medicare finally approved coverage for low vision rehabilitation services under both Part A Medicare and under Part B. Now today, I'm going to be speaking about the services that are available under Medicare Part A, which is home health care services. Now, when Medicare approved coverage for low vision services, they did set up certain criteria that you as a patient would have to meet. The first criteria is that you have a visual diagnosis, such as macular degeneration. Your visual acuity needs to be 20/70 or worse in the better eye, or a visual field down to 20 degrees or less. You need to be cognitively intact because we teach and train you with a lot of new skills and new devices, so you need to be able to learn and retain that information. You need to be homebound, and what I mean by that is that it is a taxing effort for you to leave the home, or that you need the assist of another person to get out and about in the community. You do need to have a referral from your physician. And a new thing that they're torturing us with just as of April this year is that you have to have what is called a face-to-face encounter. And this is actually a good thing. In order to participate in the program, you need to have a visit to your doctor either 90 days prior to the start of the program or within 30 days after. The other thing that Medicare requires is that you have goals that you are working on and that you achieve those goals within a reasonable amount of time. So when the nurse or the therapist comes out to see you and you set up goals to work on of things that are meaningful for you and are going to impact the quality of your life, that you show progress towards those goals. So they initially give you 8 weeks to work on those goals in which you're progressing. And 99% of the people are able to meet their goals within that first 8-week time period. But Medicare will allow you an additional 8 weeks if it's needed and you're continuing to show progress. Now, the services that Medicare will provide for you are a skilled nurse or a behavioral health nurse, occupational therapy, physical therapy if needed, and a medical social worker if needed. Now, have any of you here had home health care services before? Nobody at all? Oh, you have? Okay. That could be for some other reasons, than your vision. But I'll tell you, if you've had home health before, you'll realize the very first day can be a very lengthy visit, because Medicare is run by the government and they do expect us to fill out a whole bunch of paperwork. So if that nurse comes to your door with all these papers, that is why. And even though our agency has gone to electronic medical records, all of those forms are still in that computer and she's still got to fill them all out. So please be very, very patient with that nurse when she comes, because they do have a really tough job. Now, sometimes people will ask me, why do I need to have a nurse come out? I'm not sick, I just don't see very well. And there is a very, very good reason why Medicare requires the services of a skilled nurse. Medication errors are the #1 reason why a visually impaired person goes back into the hospital. They make mistakes with their medicines. And so our nurses will work with you to make sure that you can safely identify your medicines, administer them properly, and have a good system of organization so that, say for example, you get a refill or a new prescription, then you know how to handle that. Now also, they can help provide different devices like large pill boxes, pill cutters, and other kinds of devices that can make your medication management easier. Now, some of our patients also have diabetes, and our nurses play a very important role in working with our diabetics. It's very important to be able to obtain your blood sugar readings, and sometimes it can be difficult to read the standard glucometers. In that case, the nurse can go ahead and get a talking glucometer for the patient and train them how to use it. It's important to be able to record blood sugar readings, and they have things like 20/20 pens and large print diabetic registers that can help with that. It's also important that they take the correct insulin and to take the correct dosages of it. There's things that are different types of caps that they can put on the vials so they can discern what is the slow acting versus the fast acting. And there's different types of syringe magnifiers so that they can make sure they're drawing up the proper dose, or they can work with them with the insulin pens. And of course, it's always important with our diabetics to have good education about nutrition, as was discussed earlier, and also, very importantly, good proper care of your feet. Our nurses also provide a lot of education about macular degeneration, about the disease process, and very importantly, like we've all heard today, about the vitamins and diet that's so important if you have macular degeneration. Now, Medicare will also provide the services of a behavioral health nurse. And for those of you who are not familiar with behavioral health nursing, these are specially trained nurses to assist you with support and with coping and adjustment to your vision loss. Physical therapy is also a covered service. They work with mobility skills. We want to make sure that you are walking as safely as possible, that you can do safe transfers in your home, like especially from the bathtub or shower, up and down from chairs, steps and stairs. They can also work with balance retraining, compensation for depth perception, and sighted guide technique. And this is an area that I think is very important. A lot of our patients can do very well within their homes, but then when they're having to go out and about into a crowded area, even coming into a room like this can be very challenging. Also, things like steps, stairs, ramps, or uneven surfaces like grass or sand, it's very helpful to have training in sighted guide technique so that you can maneuver and get about in those kinds of situations more effectively. Now, we also have medical social workers, but all of our staff really, our nurses and therapists and social workers are all very well versed in the community resources that are available to help. A lot of times people just aren't aware of all the stuff that's out there. There's talking books, there's descriptive videos, there's a service that will read the newspaper to you, there's places that will help in terms of going to get your groceries picked up or your pharmacy items delivered. But a lot of times people just don't know how to access them or fill out all that forms and paperwork that a lot of those places require. So our staff can certainly help with that as well. Now, I'm an occupational therapist, as he had said, and I do think we have the most fun job of all. We get to talk to you about all your day-to-day activities and see what has been affected the most by your vision loss, and then help you figure out different strategies to make that better and easier and improve the quality of your life. Now, one of the first things that we'll do is we take a look through your home and take a look for any barriers to safety that we might see. Because our number one goal is to keep you as safe and as independent in your own home for as long as possible. So, we see a lot of those pesky throw rugs. And I can tell you, one of the things, if you get nothing else out of this today, is please pick up those throw rugs, because they are a huge source of falls in the home. And you sure don't want to have to add a broken hip on top of your macular degeneration problem. Now we also take a look in your bathroom to make sure that, is there any equipment that you might need to make you safer? That is a big area of falls in the home, is the bathroom and in the kitchen. And then we might need to mark things, especially like thresholds or the edges of steps and that sort of thing to make you safer. Now, Dr. Petito gave some very excellent examples of improving contrast. And increasing contrast in your home environment is very important, especially because it does help increase safety. And I can give you a very good example of that. I worked with a patient, probably about 6 or 7 years ago. And she had fallen 8 times in her bathroom. So when I got out to her house, I took a look in her bathroom, and it was really clear to me why she had been falling in there. Everything was white. She had white floors, white walls, a white toilet, a white 3-in-1 commode on top of the toilet. She had white cupboards. She even had a white grab bar on a white shower towel. And I can tell you, that room had to her look like a big blur. And so I asked her, I said, well, what's your next favorite color besides white? And she said blue. I said, okay, we can work with that. So what I did is I put blue strips on the handles of her 3-in-1 commode, so that way she could tell where she needed to sit. We took blue tape, waterproof tape, and put it around her grab bar so she could see where to grab to hold on to it. And I took a big dark blue mat, no skid mat, and put it outside of her shower area so that when she was stepping out, she knew exactly where to step. And we did some other modifications, like to increase contrast on her countertops and changed out some light bulbs to make them better. But I'm really pleased to say I saw her about 5 years after the first time we'd seen her, and she had not fallen in the bathroom again. So just a few very simple home modifications made her so much safer and was able to keep her in her own home, which is just, there's nothing better than that. Now, another thing that we take a look at is improved lighting. We want to take a look at the natural lighting that comes into your home, but also what kind of overhead lights you have, and then very specifically, what kind of task lighting you have. Because you may have a certain place where you sit to read, or to sit and write bills and that sort of thing, or to cook in your kitchen. And we want to make sure that you have the best lighting available for that. Because I'll tell you, there's lots and lots of different lamps, lots of different types of bulbs. Some people like LEDs, some people do better with full spectrum. But this way we can actually take a look to see what kind of lighting is the most beneficial for you. Because light and macular degeneration go hand in hand. You need to have lots of good quality light. And a new thing that's been fairly popular over the last couple of years is some very high quality portable lamps. And for people who don't want to have 4 or 5 good lamps around their house, it's a means of taking the lamp very easily from one place to the next. And we do see a lot of snowbirds, and it's very easy to just pack it up and take it back up north when you go up there in the summertime. Now, we talked a little bit earlier today about glare and light sensitivity. And even within your home, you can have glare sources. It's nice to have a lot of natural light coming in, but at certain times during the day, you may need to lower some shades or close your blinds a bit more to help cut down on glare. And I worked with a patient once, because you can even have objects in your home that create glare. And she liked to work at a particular table, and it gave me eye problems. problems when I was working with her. It was that really high, shiny Formica surface, and she had an overhead light over it, and when she turned that light on, it just had all this reflective glare coming back up. But she really liked the table, and it worked out well for her in that spot. So a simple solution to it was we just put a tablecloth over it, and she was able to use it much more functionally. So sometimes just very easy little solutions are available where, you know, it cuts down on a problem and it makes people more efficient and effective in what they're doing. And then, of course, there's always visors and hats to wear as well to cut down on the glare. Okay. Now, our therapists also do a lot of teaching and training with different adaptive techniques. Now, you know how they always say there's more than one way to skin a cat? And I'm going to give you one example, and we're going to talk about toothbrushing. Because over the years, I've had many patients tell me that it's very difficult to get white toothpaste on their white toothbrush bristles. And so I'm going to tell you a couple of ideas here. Sometimes some people just need to use a different colored toothpaste. They can see red or blue, and it's much easier to see against the bristles. Some people put it down on a black towel, and they'll just use their fingers as a little wedge to guide the toothpaste on. And then also, some people just put it in the palm of their hand and scoop it out. And some people just squeeze it in their mouth. And so there's 5 or 6 different ways to do one activity, and it can just make it that much easier. So why struggle? You know, sometimes there are other ways that can do the same job. We do a lot of teaching and training with adaptive devices. Now, are there any bingo players in the crowd? Well, we do sometimes make things bigger and bolder. Sometimes black and white and big is easier to see. And in this case, it keeps somebody doing an activity that they enjoy. Now, another thing besides just making things bigger and bolder, we can utilize some of your other senses. We have things that are called little bump dots. And they're little tactile dots that we can put on your stove or oven or microwave or laundry equipment. Or you can use your sense of feel to identify where the button is you need to push or where you need to turn a dial. There's also a lot of tactile writing guides, and there's also auditory products like talking clocks, talking watches, and that sort of thing. Now, I've been in the field a long time as an OT. It's been over 30 years. And back in the day, we didn't have this little device. This is called an easy fill liquid indicator. And back in the day, we used to teach people to stick their finger in the cup and then pour until they could feel the liquid on the bottom of their finger. But that is, I was talking to somebody earlier, it's not always the safest technique, particularly if you're pouring hot coffee. And it's not always the most hygienic technique if you're handing that cup to somebody else. So with this little device, all you do is you hang it on the cup, and then you pour. It makes that little beeping sound and tells you when to stop. And that way you don't have to worry about overpouring. And you know, the nice part is that there's many, many of these little devices that are out there. But again, a lot of people don't realize how much is really available to them. We also work with people to utilize their existing vision more effectively. Dr. Petito did mention about the eccentric viewing training. This is a technique that we can use to enhance your reading ability. We also do a lot of training in the use of optical devices and assistive technology aids. Now, as the Freedom Scientific people here today have a lot of their devices, these are wonderful, wonderful technological aids that can help you. But it is important to have good training with them can use them most effectively in the home and maximize the benefit of those devices for your day-to-day activities. Now, why home care services? As I said, Medicare does provide this under Medicare Part A, which is home care services, and Medicare Part B. Now, with home care services, we come to you. As you know, getting out to appointments and everything else can be kind of challenging if you're not able to drive anymore. So this is a big benefit, I feel, is that we come to you and we're working right there in the comfort of your own home. The other thing is that we're training you in using your own stuff. You know, if you're going to practice baking or using the microwave or doing your laundry or working on your paperwork, why not work with your own things? It just makes sense to me. And then if modifications are needed, like the bump dots or that sort of thing, we can make those adjustments right there. And the services are provided on a one-on-one basis. So it's just you and the therapist or nurse who's teaching and training you. And I think the best part about it is that it is 100% covered by Medicare. And there's not many services out there these days that are 100% covered, especially something that can really improve the quality of your life. Thank you very much.
Okay, it's time for a short break. Let's make it short so we can get right back on schedule. We have one more speaker and then we'll close it in. You tired yet? Okay, please continue to prepare your evaluation so you don't have to remember who all the speakers were. Thank you.